Well, hello, my friends. Dr. James here, and I'm truly glad you're joining me today. This isn't one of those flashy, fast-cut videos with high-end editing. It's an audiobook-style conversation offering pure, real-life advice. No bullshit here, just practical, science-backed knowledge. And trust me, you'll want to stick with me until the very end. There's a little suspense I've woven into our discussion that you don't want to miss. So, settle in, grab a cup of tea, and let's explore some signs that could help you or a loved one stay ahead of dementia. Let's begin with a surprising thought. Dementia might start showing its signs up to 10 years before a diagnosis. Most people miss these early clues, but today I'm sharing 9 subtle early signs and 13 classic symptoms that matter. This is all about empowerment, knowing what to look for, and understanding that early awareness can lead to better care. I encourage you to watch the full video, engage in the discussion, and even share your experiences in the comments below. Your insight might just help someone else in this community. I want to start by describing those early hints that often get mistaken for simple forgetfulness or normal aging. One of the first signs I've observed is a subtle change in one's sense of direction. Imagine that internal GPS you've relied on your entire life. When it falters even a bit, you might find yourself confused in familiar surroundings. I recall a patient, John, who'd been a confident driver for decades, but began admitting he was losing his way in his own neighborhood. It wasn't dramatic, but it was a red flag that warranted a closer look. Another early sign is trouble understanding sarcasm or jokes. Our brains work hard to decode not only words, but the tone and nuances behind them. When that ability weakens, a playful remark might feel confusing or even hurtful. It's not that humor has lost its charm. Rather, the brain's interpretive skills are shifting. Have you ever found yourself missing the punchline of a joke? If so, let me know in the comments. Your experience might be more common than you think. Some people also start withdrawing from hobbies they once loved. Whether it's reading, gardening, or a favorite card game, a gradual loss of interest can be an early sign of cognitive change. I've seen this happen with a few patients who slowly stopped engaging in activities that once brought them joy. It's a subtle change, but it's worth noticing, especially when it appears alongside other symptoms. Then there's the curious case of misplacing items in the most unexpected places, like keys ending up in the freezer or glasses left in the garden. This isn't just clumsiness. It's the brain's storage and retrieval system acting up. When such misplacements become a pattern rather than an occasional accident, it's something to keep an eye on. Subtle personality changes may also occur. Perhaps a once outgoing friend or family member now appears more withdrawn or even irritable. These changes can be slight at first, but over time they may indicate a shift in how the brain processes emotions and social cues. Along with these shifts, some patients report a decrease in empathy. You might find it harder to connect emotionally with others or recognize their feelings. Difficulty with planning or organizing is another sign. Tasks that were once routine, like planning a meal or managing your schedule, suddenly feel overwhelming. It's as if the mental blueprints you once relied on have become a bit fuzzy. And finally, there may be changes in how you perceive visual information. This isn't about your eyes failing. It's more about the brain's ability to interpret what you see. You might struggle to judge distances or even recognize familiar faces under certain conditions. Each of these early signs, directional changes, misinterpreting humor, withdrawal from hobbies, misplacing items, personality shifts, decreased empathy, planning difficulties, and altered vision, are subtle clues. They're your brain's gentle way of signaling that it might need a bit of extra attention. I urge you not to dismiss these signs as mere aging quirks. Instead, pay attention to patterns and consider discussing any persistent changes with your doctor. Now, let's shift gears and talk about the 13 classic symptoms of dementia. Symptoms you might have heard of, but which deserve a fresh, deeper look. First on this list is memory loss that interferes with daily life. We all have moments of forgetfulness, but when memory lapses disrupt your ability to manage everyday tasks, it's a sign that deserves attention. For example, if you find it increasingly difficult to remember appointments or even simple daily routines, that could be a signal. Confusion with time or place is another classic symptom. Have you ever felt disoriented about where you are or what day it is? This isn't just a momentary lapse. It might be your brain struggling to keep track of the details. Then there are challenges with words. You might search for the right word in the middle of a sentence, or notice that forming coherent thoughts has become more taxing. It's as if the well-organized library of your vocabulary is missing a few volumes. Poor judgment is also an important indicator. Perhaps you're taking risks or making decisions that seem out of character. This shift in decision-making ability can have practical consequences in everyday life. Similarly, many experience trouble completing familiar tasks. Whether it's cooking a simple meal or following a well-known recipe, tasks that once came naturally can become challenging. Mood swings and changes in personality are among the more emotionally noticeable signs. You might find yourself unusually irritable, sad, or indifferent, emotions that don't quite match the situation. Then there's difficulty with spatial relationships. Activities like driving, navigating crowded rooms, or even walking in your own home may start to feel more challenging as your ability to judge distances declines. Another classic sign is having trouble following conversations, especially when multiple people are involved. It's not about a lack of interest. It's simply that your brain isn't keeping up with the rapid exchange of words. Forgetting names or faces can be particularly distressing. You might recognize someone but struggle to recall their name, or vice versa. Losing track of time is also a common issue, with days blurring together and routines becoming irregular. Repetition is yet another symptom. If you find yourself asking the same questions or retelling the same stories, it might be a sign that your brain is trying to hold on to information that slips away too quickly. Misjudging distances while walking or driving is not only disconcerting, but also potentially dangerous. And finally, unusual emotional responses, such as sudden apathy or irritability without a clear cause, can be a telltale sign that something isn't quite right. As we go through these symptoms, I want you to reflect on your own experiences or those of someone you care about. Have you noticed any of these patterns? Please take a moment to comment below with your thoughts or personal stories. Engaging in this conversation might bring comfort and clarity to others who are watching. I understand that discussing these changes can stir up worry. But remember, occasional forgetfulness is normal for everyone. The key is to be mindful of patterns. If these symptoms become frequent and begin affecting your quality of life, it might be time to have a thorough discussion with your doctor. Early screening is crucial because an early diagnosis allows for better planning and more effective care. I've witnessed time and again how early intervention can significantly improve outcomes, giving you the best chance to manage your health proactively. Allow me to share a brief story. I once treated a wonderful patient named Mary. Mary was a vibrant woman, always at the heart of her community. Over time, she began noticing small changes, Sometimes, she'd forget familiar routes during her walks in the park or lose track of details in conversations with friends. Rather than dismissing these changes as mere aging, Mary sought my advice. We ran a series of assessments, and while the findings were concerning, they were also a call to action. Mary embraced lifestyle changes, engaged in brain-boosting activities, and leaned on her family and friends for support. Today, Mary manages her symptoms with a combination of regular checkups and positive lifestyle adjustments. Her story is a reminder that early detection is not a sentence, but a stepping stone to continued living a fulfilling life. Midway through our conversation, let me pose a challenge. Think about one small habit you can adjust today that might boost your brain health. It might be as simple as taking a brisk walk, doing a crossword puzzle, or having a conversation with an old friend. I'd love for you to share your ideas in the comments. Your simple step might inspire someone else to take charge of their health. Before we conclude, let's recap an essential message. Knowledge is power. Recognizing these signs is not about causing alarm. It's about empowering you to take control of your well-being. If you notice a persistent pattern of these symptoms, don't hesitate to consult your healthcare provider. Early detection can make a world of difference in managing your health, ensuring that you continue to live a rich and independent life. As you listen, consider subscribing to our channel, not because we want to interrupt your day, but because staying informed is crucial, and we're committed to bringing you straightforward, science-based advice in a conversational tone. There's no hype, no fast edits, just practical information you can trust. Your subscription helps us reach more people who might benefit from this knowledge. To wrap up, I want to invite you once more to engage. Tell me in the comments, have you noticed any of these early or classic signs in yourself or someone close to you? What small changes have you made in your daily routine to support your brain health? Your experiences and tips can offer hope and guidance to others walking a similar path. Remember, this conversation is a continuous journey. Stay curious, remain proactive, and most importantly, take good care of your mind and body. I'm here as your friend and your doctor, dedicated to offering genuine advice without any distractions. Until next time, my dear friends, keep nurturing your wonderful minds and living life with confidence. This is Dr. James, signing off with a warm smile and a heartfelt reminder. Every small step towards awareness is a big step towards a healthier, happier you. Thank you for staying with me throughout this conversation. I hope you found it as enlightening and reassuring as I intended it to be. Please subscribe, share, and comment. Your voice matters. Let's continue to support each other in this journey of aging gracefully and wisely. Stay well, and I'll see you in the next video.